Hi, this is Kelly Curley, and we're going to talk about teaching and learning strategies. This is for NUR 111, so let's get started. I've attached a copy of your learning outcomes. I'm going to let you read those. They're the same ones that are on your module. Let's go on and talk about what is teaching. So teaching is, I want you to take just a minute and think about, you are going to define what teaching is. What would you fill in the blank with at the end? Teaching is, think of good things, not bad things. Okay, so the first one I would think of is teaching is ongoing. We know, you understand that you can't just get it one time and done. It's an ongoing process. There's assessment of what people need to know. There's providing the teaching. There's evaluating to see if learning occurred. So it is ongoing and ever changing. Teaching should be interactive, so that's why it's kind of hard how we're doing this now, because I struggle. I want to see your face and I want to be able to interact with you and to get your feedback of whether or not you're understanding. So hopefully you're teaching your patients right in front of you and you'll be able to be interactive with them. Teaching should be individualized. It should be what your patient needs, not what everybody needs to know, but what do they need to know and how do we help them learn it the best. Teaching should be collaborative. If there's someone else that's an expert in that area, that's who we need to pull in to help us with that piece of it. It should be planned. You're going to need to think about, what does your patient need to know? What's most important for them to know? Do they have the resources they need? When am I going to start this? Is now a good time to teach? So it kind of has to be a little bit planned out. Teaching has to undergo a trusting relationship. So you want to make sure, that your clients feel comfortable speaking with you and that they respect what you're saying as well. Teaching needs to be easy to understand. So there's very complex ideas and complex things that we talk about in nursing and in healthcare. And a lot of times it gets very, very complicated. So we need to take it and bring it on down a notch. And what do we really need to know about it? And how do we make that information easy to understand? Mutual goals. Maybe what you think is really important is not really what your patient thinks is really important to know. So we need to find a happy medium. They need to know how to take care of themselves, right? But then again, this is important to them. So we need to make sure that we're developing some mutual goals for what they want to learn and what they need to learn. Teaching should be inclusive. We need to include whomever needs to be involved with that care, whether that's the client, whether the client's support system or family needs to know, or client has a caregiver. It could be a group of clients. One day you're probably going to have to teach your peers in nursing something, especially as new things come on the unit. You may be teaching your unlicensed assistive personnel. You might be teaching them why it's important for that turn Q2 hours or less than Q2 hours. You might be teaching them about some different ways to help with ambulation or moving around. So making sure that you're teaching, everyone. One day you're going to be teaching and orienting new employees to nursing. So you too will get out of nursing and find your way through that first year, and before long you're going to have a student with you or you're going to have a new employee with you. So you passing along that knowledge, whether or not you really want to be a teacher, you're kind of a teacher at heart whenever you go into the role of nursing, because we have to teach our clients things, right? So what kind of things do you think you're going to have to teach a client about? One of the big things that you probably already have been doing some teaching on and didn't even really realize that you were teaching was medication administration. So when you go in and you give meds and you're teaching them, this is your metoprolol and it's your beta blocker and it's for your high blood pressure. And, we checked your heart rate and we checked your blood pressure and we can give it because your heart rate is this and your blood pressure is this, but if it was too low, we wouldn't give it. So you just talking about what you did is really teaching the client. So we teach a lot about meds. We teach a lot about health prevention activities, things that are so simple and it can go across the lifespan. So let's talk about some health prevention stuff you may think about with young kids. Especially we're thinking about injury prevention, right? So wearing their seatbelt, wearing a helmet, not talking to strangers, whether that's in person or over the internet, right? not approaching stray animals, waiting for other animals to come approach them, safety in their surroundings, looking both ways when they cross the street, don't take grandma's pills. That can just be anything as far as health promotion and injury prevention. It also goes with older adults too, like making sure that we're teaching them and helping them find a means to set themselves up for safety. Our older adults are just as risk sometimes as our infants and our younger adults, in the fact that maybe their seeing's not as good as it used to be, or maybe they don't have the physical dexterity to open pill bottles. For those of you that have given meds the last couple weeks, I joke with my group because medications used to just be kid proof, but now they're adult proof. You can't get them open. And imagine if you couldn't feel real good or you couldn't use your hand really good to get medications open. So can they see? Can they hear? Do they remember which one's their meds and which one's their spouse's meds? Because that happens sometimes too. So health prevention, injury prevention is going to be a big thing that we do teaching about. You may have to teach your clients how to do procedures. Clients go home with in and out catheterizations, they go home with dressing changes, they go home needing to check their blood sugar and figure out how to give themselves injections. So there are a lot of procedures and skills that you might have to teach someone. Teaching a client about a disease process. If you've been in the room whenever you hear a healthcare provider come in and they give a new diagnosis, oh yes, you have hypertension, you have high blood pressure, you need to take this pill, and you know, we're going to check you in the office, blah, 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 blah. And that's about all they get as far as that good teaching about, well, what does this mean? You know, does this mean I'm going to be on a pill forever? Should I be eating something special? Should I be exercising? So about the disease process, and then what's some ways that we could help them be successful in their management of care. The process for how things work inside and outside the hospital. Many times, and if you have seen your client get information from the healthcare provider that they're going to be discharged, and they're like, yay, I'm going home. Okay, so when do I go home? And you're like, I don't really know when you're supposed to go home. But the doc said, they just came through and said I went home. Okay, well, what does that process look like in the hospital? When the doctor says you can go home, that doesn't mean the patient's really ready to go home yet, right? They're still got things like their IV is in, they haven't had their morning medications. We got to set up their discharge paperwork and their follow-up appointments. Oh, do you have somebody to drive you home? Well, we need to get this first, and when's your person coming to get you? So there's a whole lot of information that nurses give just about how the process works in the hospital. Or they come in and they get a test done and they want to know the results right then. Well, you don't have the results yet. The radiologist has to read the results, and then they'll call it to the doctor, and then the doctor will come in and talk to you about your test results. So a lot of teaching is stuff that you do all the time, communicating with your clients. You may not even realize that you're teaching. So nurses in teaching, why do nurses need teaching skills? First of all, clients and families need and have a right to informed decision making. They have a right to know what's going on with them, to understand what's going on to them, and to be able to make the right decision as to their care. Nurses need to know how to teach so that we can do health promotion and disease prevention, especially if we can help people to not get these chronic long-term diseases, if we can help prevent that. We need to know it so that we can help them restore health or cope with chronic impairment and chronic illnesses. There are some things that are lifelong chronic illnesses, and patients need to know, well, what's the natural progression? How do I deal with this? How do I stay as healthy as I can with this chronic illness for as long as I can? It helps with shorter hospital stays. Those shorter hospital stays actually increase the need for teaching at an earlier time frame, and teaching about what they're going to need at home. Teaching helps to facilitate maybe that they're not in the hospital as long, but it also requires you to start that process early. You can't wait till they're getting ready to go home, because as soon as they hear I'm going to be discharged home, they're already like, I need a bag to get my stuff together. Let me call my spouse or my loved one. When can you get off work and come get me? Where's my pills at? Am I going to take those at home? I think I'll just take those at home. I don't need to take those here. They're not really thinking about, oh, I need to know this new information when I get home. And we a lot of times have clients call us after they get home because they're still kind of unclear about things. So we want to make sure they have a really good understanding, and we got to start that process earlier. Teaching helps to empower them too, to ask those questions and to be their client advocates. Remember Florence Nightingale, a long time ago, old Flo, she started teaching. She was the first real nurse and teacher about infection prevention and nutrition and light and things that seem so kind of basic and silly to us, but somebody had to start that, you know? There are ethical and legal requirements to teaching, and we'll talk a little bit more about that later on, but when a nurse fails to provide adequate client teaching, and I will go a step further to say when a nurse fails to document that they provided adequate client teaching, clients may have an area for litigation to come in and say, well, you didn't teach me what I need to know, and I came right back in the hospital, and I'm not paying for that because you didn't provide me with what I needed when I went home. So making sure that not only you're teaching, but you're doing that documentation piece of it to show that you provided that teaching is going to be key. Teaching with your clients takes practice. It takes commitment. It does help to improve long-term outcomes, but you really have to be kind of the cheerleader for your client and getting excited about it. So our goal of client teaching, let's talk about what's our overall goal. What do we hope? We hope to provide information to affect change. And that change might be in knowledge of what they know. Their change might be a change in attitude, like, I didn't really care about stopping smoking, but now you're talking to me about it, and maybe I really should cut back because, I've been having some problems with my breathing. So maybe it's a change in attitude. Maybe it's a change in skill or procedure or how they do things. We hope to maintain life, improve health, and maximize their quality of life. Sometimes maximizing their quality of life is really providing the teaching so that they can have a dignified death or a dignified end of life, the way they would want to have it. There is a big push in our community, and there needs to be a big push in our community to increase health literacy. So your book talks a little bit about what health literacy is, but it is the ability to obtain, read, understand, and act on health information. So I'm going to say that one more time. Health literacy is the ability to obtain, to read, to understand, and to act on health information. And this is a big problem in the United States. It's a big problem across the United States. I may be able to obtain it and read it, but I might not have a clue what it is saying or have the ability or the knowledge of how I'm supposed to act on this knowledge. It can affect so much. It can affect our access to care, who has access to care, what kind of healthcare they access. It can affect our clients' adherence to their healthcare plan. Do they have access to what they need? Do they understand what they need? How do they act on that knowledge? It greatly affects our clients advocating for themselves and their families. We need to empower our clients to know more about what is going on with them and that it's okay to ask questions. It's okay to not agree because maybe you don't understand because nobody's taken the time to really figure it out and help you understand. So let's work on improving that health literacy in our entire community by working on really teaching our clients that it's okay to ask questions. It's okay to not know, but go ahead and ask, and let's see if we can help you understand some more. So there's a lot of programs out there that are currently, the goal is to help increase health literacy through them. The Affordable Care Act, the National Action Plan to Improve Health Literacy, National Patient Safety Foundation, and another one is the Ask Me 3. So I've put a link here, a hyperlink, and I'm going to let you go to that on your own time. It opens in a new tab, and it's really the clients should go to their healthcare provider and they should be asking 3 questions every time they go. Get used to asking questions. Get used to getting together and formulating those questions before your healthcare provider is in front of you. Because many times your healthcare provider is not in front of you for a very long period of time. If you get 15 minutes, it's gracious sometimes that they spend that time with you. So having those questions together of what do I not know? What do I need to know? What is it that I really don't understand before you go to the healthcare provider or before the healthcare provider comes to your room is going to be a huge, huge thing. Another huge goal of client teaching is really to encourage meaningful conversation. I know a lot of times in the clients' rooms, I have like a little chit-chatty information while the students are in there working. How are you? How'd you rest last night? What kind of work have you done? Where do you live around here locally? Just kind of chatting up. But what we need and what we're trying to get to once we establish that rapport is really encouraging meaningful conversation. Getting the clients to talk about and work through different things. Not that we're going to have the answers for them, but if they can start kind of thinking and talking about what am I going to need at home? I don't know how I'm going to take care of myself. I'm kind of worried about taking care of myself. I usually take care of so-and-so at the house and I can't even take care of me right now. How am I going to take care of them? Those are all meaningful conversations. Those are hard conversations to have. And there's other really hard conversations to have with clients. There's hard conversations for nurses to have. There's hard conversations for clients to have with their loved ones. So that's where the Speak Up campaign kind of comes up with. It's really how to have difficult conversations with people you care about. That, in some essence, is a goal of teaching. You establish that rapport. You're teaching clients what they need to know. They may open up and talk about what they're concerned about, and letting them have the chance to work through that during your teaching session may be really important. Your book on page 186 has some different goals of clients teaching listed. It's in box 9/1, so it may be something great for you to look at. Let's talk a little bit about the legal implications for teaching, because there are legal implications and legal requirements. So the first one is the Joint Commission of Accreditation of Healthcare Organizations. It does have a standard that states that hospital staff serve as a critical resource by acting as skilled client educators. You didn't know that. You were going to be a skilled client educator one day, and you are. There's also patient care partnerships, which like the Patient's Bill of Rights, that says the patients have the right to current and complete information regarding their diagnosis, their treatment, and their prognosis in ways that they can understand. Now, a lot of that comes from the healthcare provider as far as their diagnosis, their treatment, their prognosis, but they still have a right to that complete and accurate information regarding their medication or regarding how to perform this skill or where am I going to get this stuff from to help me when I get home. The American Nurses Association also has standards of care and standards of practice that revolve around teaching. So the American Nurses Association says that we're to provide teaching that addresses healthy lifestyle, risk reduction behavior, developmental needs, activities of daily living, and prevention. We're also to use health promotion and health teaching methods appropriate to the patient's developmental level, their learning needs, their readiness to learn, their ability to learn, their language preferences, and culture. And the third thing, the American Nurses Association says that we're to seek opportunities for feedback and evaluation of the learning. It's not enough to say, okay, here it is. I've given you all you need to know. Peace out. I hope you got it. Good luck. Do a great job at home. No, we need to make sure they really got it. We need to seek opportunities for them to tell us, I don't understand, or I kind of got it, but I got lost here when you started talking about this. So it's not just giving the knowledge, but it's making sure that there is a change in the understanding that they have and that they know how to act upon that knowledge. Okay, teaching and learning. Teaching, we talked about, should be interactive process. I wish it was more interactive right now. Involves planning and implementing instructional activities to meet learner outcomes and provides activities that allow clients to learn. So what is learning, right? Learning is a change in behavior, knowledge, skills, or attitude. So that change can occur as a result of exposure to something in the environment. Learning is definitely an active process, and it's involved more than me just spitting out information to you. So I can tell you what you need to know all day long, but until you take an active role in that learning, it doesn't become real to you. So the key aspects of teaching and learning, just some general things across the board, is listen to the patient and the family. You may go in with a preset, this patient needs to know this. They got to know it. They need to know how to do it. This is my number one thing they got to teach them. And you might walk in and that patient tells you that they know they got to know some stuff, but they're really, really concerned about something else. They're probably not going to listen much to you until you address their other concern, right? So you got to listen to the patient and the family. Every interaction is an opportunity to teach. Don't think, okay, well, I'm going to go do all my assessments and then I'm going to go give all my meds and then I'm going to do my dressing changes and I got to discharge this person and then I'm going to go in there and I'm going to teach that patient. Well, by that time, you've already been in the room 3 times. Doctors come around and said, hey, we're going to discharge him later. And you're thinking, oh, I haven't get to talk to him about that yet, but I'm just going to hit him with it at the end. No. Every opportunity should be a moment to increase that rapport with your client and provide some teaching and to follow up on previous teaching. Especially if you know the shift before you or the nurse before you they went over some stuff with them. When you go in and you're working with them doing the same thing, taking it a next step to see, did they really get it? Keep education client-centered and begin teaching as soon as possible. Can't wait till discharge because clients don't stay in the hospital that long anymore. They are in and out the door quickly. So there are 3 main domains of learning that your book discusses. A lot of these go along with the way that you learn or different ways that you learn. The first one is cognitive. So cognitive is the storage and recall of information. So you're storing that information, you're recalling it. It's about the disease process or maybe about the medication or about the side effects. And it's remembering that stuff and pulling it back out. Psychomotor is your hands-on skill. It requires you thinking and doing. An example of psychomotor would be self-administration of insulin, but you can even go a step further. Let's think about, what about a client knowing how to take their own pulse, their radial pulse? Maybe they're on a blood pressure medicine. Maybe their cognitive knowledge is, that is my beta blocker, and that helps with my high blood pressure. And I need to check my heart rate before I can take this medicine, and if my heart rate is less than 60, I'm not going to take it. But then their psychomotor part is they have to be able to physically know how to take their own radial pulse, right? They got to know how to take their pulse, and they got to know how to check their blood pressure. So that's the psychomotor, the hands-on skill part of it, whereas the cognitive is just the storage and the recall of information about the med. The last one is your affective domain, and change in feelings, beliefs, attitudes, and values. So this is trying to help your client find meaning in order to make change. A lot of times I know here what I need to do. I need to eat better. I need to exercise. But it doesn't mean I put those thoughts, those feelings into action. I need to make it meaningful for me. Why do I need to do this? How am I going to change my beliefs about it? How am I going to change my attitude towards it? How am I going to motivate myself to go do it? So that's the affective domain of how do we change those feelings, beliefs, attitudes, values. I will say that's probably the hardest domain to hit on. Some people are ready to change and some people are not at that point yet. Some people are just doing what they can do to survive on life. They don't need any more change right now. So being okay with the fact that, I realize you're not there yet, but when you are there someday, let's talk about how would you go about stopping smoking? How would you go about exercising more? Do you think we could incorporate just a teeny tiny little bit of it where it's not so overwhelming for you? So trying to hit on those 3 domains of learning is really a great way to encompass and incorporate different types of learning, because some people are more cognitive. Some people really like that psychomotor part. If you give me something to do with my hands, I'm good with it. And some people are really tenderhearted and you can really get their affective domain, but not everybody's the same. So you need to try to hit on different points of learning and different domains of learning to really help your clients advance. All right, factors that can affect client learning. Let's talk some more about this. Number 1 thing I put was motivation, right? This is one of those things that usually you have to be motivated to learn. Typically, if we're not very motivated, we can try our best. And I'm sure you've been at the point where you have been trying to learn been trying to read the book, but you're just not feeling it right now. And you're going through the motions, but it's not really sticking because there's not that motivation there. So how can we motivate it? First of all, it tends to be better if it's something you're interested in, right? So find a common interest. Show the respect to the learner, because we're all learners at one point in our life, and we all struggle with being motivated at some point. Make sure you're warm and friendly. Maybe the learner needs to offer themselves some rewards and incentives. I'm going to study, I'm going to read, I'm going to try to do this for so long, and then I'm going to take a break, or I'm going to go for a walk, or I'm going to have a bite of chocolate because I really like some chocolate. So give themselves some rewards or some incentives. The patient needs to believe that the information is important for them to learn. So kind of tell them where to focus and where not to focus so much on is going to be important. Readiness to learn. So readiness to learn can be based off their physical condition, or it can be based off their emotional condition at that time. So physical, if they are in so much pain that they are writhing around in the bed and you're trying to get their pain under control, they're probably not going to remember a lot that you're teaching them about their new diagnosis of diabetes. Let's just be honest. All they think about is they hurt, and they want you to be quiet and get out of the room, right? And help them with their pain. Go give me some pain pills. So are they physically ready to learn? Same thing if they can't breathe well. If they can't breathe well at the time, now is not the time for you to teach them about their long-acting beta-2 agonist. That's not the time. They just want you to give them something to help them breathe better. You can teach me about the other stuff later, but don't ask me 40 million questions, and don't teach me something right then when I'm not physically in the good spot to try to learn something. Same thing if your client's on pain meds and they're laying there and they're half asleep and they're falling asleep while you're trying to teach them. Probably not retaining very much. Emotionally, are they ready to learn? If they just found out that they have some big life-altering diagnosis, they may need a little time to digest that information before you go in and you start teaching them about all the stuff that's going to happen. We see this a lot on the first floor where I'm at clinical at. Clients sometimes get a new diagnosis of cancer, or their first diagnosis of cancer. And the healthcare provider says the word cancer and where it is and gives them their prognosis and tells them kind of like, okay, here's the plan. You know, we're going to put a port in, you're going to start some chemo and radiation, nurse is going to be in to talk to you about this kind of stuff, and blah, 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 blah. They walk out the door, nurse goes in the room, and the patient didn't hear anything after the word cancer. They call it the nasty C word. They hear the cancer word, and it's just, their mind has gone somewhere else. How did this happen? What am I going to do? What's my family going to do? How long do I have? All these other thoughts. They're not ready to obtain and retain more information at that time. They need time to compress, to work through what they just heard before you present them with new things that they need to learn and teach at that time. So they need to be ready. Now, with that being said, you can't wait around too many days before we start trying to get them to work through those things to get ready. But we need to make sure that we're approaching clients when they're ready. Timing, we talked about when they're ready to learn. If you can time it with what you're doing, for example, if you're given blood pressure medicines and you know they need to check their heart rate, let's teach you how to check your heart rate. Okay, right here's where you feel your radial pulse. Okay, do you feel it? Have them actually physically feel it for their radial pulse. Okay, let's count together for a minute and see what we get. You can time it to where you're not having to go back in the room and teach them something that you just did. You can time it where you're teaching and doing at the same time. Active involvement. Remember, people remember about 10% of what they read and about 90% of what they speak and do. So if you can get them to teach it back to you, if you can get them to do it, they're going to remember more of it. Type of feedback given. So think about this from your perspective as a learner when you're teaching your clients. Would you want your clinical instructor to say, you did absolutely horrible with that insulin injection. Like, I don't know what you were thinking. You need to go back to see Miss Moose in the lab. That was horrible, awful. You will never give me insulin. You would probably start crying. Hopefully you tell somebody else, because that was probably not the best feedback. But you need to give them some positive feedback to encourage them. That doesn't mean if they did a horrible job that you're going to lie to them and tell them they did well. You're going to give them constructive feedback. You're going to say, you notice You washed your hands before you did that. That was a really great thing. I noticed that you washed your hands and you cleaned off the area with the alcohol swab. That's great. Now let's focus on how you hold the syringe or how you inject with the syringe. So use constructive criticism and give them some feedback that has a little bit of positive, but is also very honest with them about what they need to do. Repetition. It's okay to repeat what you taught. It's okay. Many times when I say something and y'all kind of get the glazed over look, I'm like, oh, they didn't get it. So I have to say it again. In fact, so much that sometimes I just say it over and over again anyway, and I don't realize it. So repetition is good for your clients. Doing it over again, having them do it over again, having them repeat information back to you that maybe you talked about earlier. The learning environment. It needs to be quiet, not so loud. Should be non-distracting. We try to keep things very private. We want to make sure that the curtains pulled, the doors closed, so that you can really focus and so that your client can really focus. Some other factors that we want to talk about are scheduling. So if you can do small, frequent times of telling the client what they need instead of one big time teaching session, that tends to work better. So if you could break down into, especially if you had the client for multiple days, the first day you're telling them about their new medication, their new beta blocker, and the side effects and what it's supposed to do. The second day, you're having them check their pulse and tell you what they remember from the day before. So schedule smaller, more frequent kind of sessions to go over the content with them. The amount and complexity of content. The greater the change the client needs to make, the harder it's going to be for the client to make that change and the more information there's going to be for them to learn. Sometimes we just need to help simplify the information. Keep the medical jargon out of it. Focus on the important concepts. I know we ask you, how does a beta blocker work? And we want to hear something about beta cells, and we want to hear about peripheral vascular resistance, and we want to hear about slowed conductivity through the heart muscle and decreased cardiac workload and all of that wonderful stuff. But your client's not going to understand any of that, because half the time y'all look at us like y'all don't understand it, right? Because it's a lot of big words. So break it down. This is going to decrease your blood pressure. This is going to slow the heartbeat going through your heart. It's just going to slow your heart rate down. It's going to help your heart not to have to work so hard. So that's why your healthcare provider has you on it, right? So keep it simple. Focus on the important things. Work on your communication and your barriers to communication. Look to see, does your client and you, do y'all have a language deficit? Make sure you're getting on the client's level, whether that's through language, whether that's culture, whether that's developmental. You need to be making sure that your communication is open communication with your client. Next one down, belonging to any kind of special populations, whether they are part of a special population, make sure that you're being inclusive to them and not singling them out. Some clients really struggle with dyslexia, getting things mixed up on paper, certain words. So if you just give them a printed handoff, they may not understand all the words, especially if it's got a bunch of medical jargon in them and they're not really sure if that's the way the word's really supposed to look. Am I flipping it around or not? Same thing with attention deficit disorder. If they get very easily distracted and you're trying to teach and talk and do all this stuff and the TV's on and the door's open, their mind is bouncing around everywhere. We may need to figure out, when's the best teaching time for you? How do we decrease those distractions for you so that you do understand and you are able at that point to really concentrate on what's going on? If there's too much stuff going around, it may just be overwhelming for them. So look to see, is there different ways that we need to tailor our teaching environment or tailor our teaching strategy to help clients better. Remember age and developmental levels. Your book talks about Piaget's stages of cognitive development. You have been through psych. You do not need to remember that for me. But think about and be familiar with, how are you going to teach a 4-year-old something? How are you going to teach a 9-year-old something? How are you going to teach a 15-year-old something of normal growth and development? I know with my children, I have to really think about what I say to my 8-year-old to give them the information they need, but not promote fear and where the questions are probably going to lead with that. So think about age and developmental level when you're talking with children. Culture, be aware of your client's cultural norms, their values, their communication, their social structure, their time orientation. It could be something as simple as lack of eye contact. It could be something about their family. Maybe it's a dietary change, but they're not the one that primarily cooks in the house. Maybe it's a time orientation piece where you need to take your meds at this, and this time. But for them, time orientation is a little bit of a different concept. Um, find out what works for your culture. I've seen a lot of people go in and try to do some wonderful teaching on diet, and clients are from a different culture. They don't eat any of that stuff. They're not, you're like, okay, they're not going to eat any of that. So find out what they like to eat and what fits in with their cultural norms. That's stuff that we need to teach related to whatever new thing is coming with their health promotion. Last thing on here is literacy. So never assume your client is literate. A lot of times clients that are not able to read or write, they've learned how to hide it really well. So don't assume it, and make sure we're very non-judgmental in our care. You can ask them to read stuff to you. You can create short sentences, easy words, drawings, pictures. You can use a lot of other ways. People don't have to have something that they can read to take home to remember what they need to do, whether that's drawings, cue charts, whatever helps them the most at home, because maybe they're more of a visual person anyway. Maybe that would help them more than a piece of paper that tells them what to do. There are some steps in the teaching learning process, and these should look very, very familiar to you and what you just learned about with some clinical decision making. So first, we need to assess learning needs and readiness. Number one thing, what do they need to know? I mean, do they need to know like this much, or they need to know like all of this stuff? So what is it exactly that this person needs to know? And are they ready to learn it? We're going to need to develop some learning outcomes. What do you hope they know at the end? How are we going to teach them? Implement it. We're going to evaluate. Did they learn? Did they not learn? Are we missing some key points? Did we kind of get it, but we kind of missed this part down here? We need to go back and hit that part again. And then we got to make sure, very last part, we got to make sure we document. So page 187, there is a box 9-2 that has some of these steps of the teaching and learning process and kind of lays it out. I thought it was very easy to read, so it's something you probably want to look over as well. So the first role of the nurse in this is going to be your assessment, correct? So what should the nurse assess regarding learning, right? First thing is we need to know what's necessary for the client to learn. What do they need to know? We need to look at what does the client want to know, because what they need to know, what they want to know might not match up at all. What anxiety do they have about this? What motivation do they have about this? And is the client willing and ready to learn at this time, right? Second part, we're probably going to need to come up with a nursing priority problem. This may not be your number one priority problem for your patient, but it may be an identified problem for the future. They need to know how to take care of themselves at discharge. But right now I'm trying to get them ready for discharge because they're still really sick in another area. Maybe it's oxygenation or elimination or infection. Maybe they have this other problem going on, but there's going to be a knowledge deficit. They're going to have to take care of something at home. And I know that's something we're going to need to know about. So we got to go ahead and start that process. There's a couple different nursing diagnoses that you'll see out there. One of them is knowledge deficit. If you say they have a knowledge deficit, then tell me what they don't know. Where is their knowledge deficit? I have a lot of knowledge deficit about a lot of things. I don't know very much about cars. I don't know very much about electricity. I don't know hardly anything about plumbing. But that doesn't really tell you anything with needing to educate me to send me home, right? So what exactly do they not know that they need to know going home? Do they need to know about their medication? Do they need to know about that dressing change? Do they need to know signs and symptoms of infection? What exactly don't they know? So if you're going to do knowledge deficit, then be a little bit more specific and say, well, where is their knowledge deficit? Maybe they don't know anything about it at all. And we just need to start from the disease process and ways to give themselves medicines. Maybe there's a bunch of stuff, or maybe it's just one thing. Tell us a little bit more about what they need. Then there's also a readiness for enhanced knowledge. Sometimes clients are like, I know I need to know how to do this, and can you teach me about it? And those are the people you want, because you're like, yes, I can so do that. Thank you. And so they're ready to learn, and you're like, okay, readiness for enhanced knowledge. They want to know. They want to know what they can do. They're going to be their advocate. They want to know how to get their meds, what they're going to do with their meds, how they're going to know if they're working. So there's a couple different ones that you can use. After we identify it as a priority problem, or not a priority, but a problem we need to be addressing, we want to come up with a plan, right? We need to come up with some goals and expected outcomes. So we want them to be SMART, right? Specific, measurable, obtainable, realistic, and time-oriented. You can set a goal. I've set several goals, but they're not very SMART, and they don't really happen because I'm not specific in them, and I'm not measurable, and I don't give a time frame, or it's really not realistic. So make sure that they're those SMART goals, because those are more likely to be obtainable, and we can also measure to see, did we hit that goal or not? Client outcomes. Some client outcomes that you might see related to teaching and learning include, and these are just some examples, the client will explain the disease process, they will recognize the need for medications, they will understand their treatment. The client will be able to explain how to incorporate their new low sodium diet into an example of a meal for 24 hours or their 24-hour food diary. They can look at it and do it. So you can be really specific with it. Maybe the client states or demonstrates how to perform a procedure. So the client will demonstrate how to accurately and safely give themselves an insulin injection. Okay, wonderful. And then we've got to put a time frame on it still, right? The client will be able to list resources. So the client may list 2 resources that they can access on an outpatient basis to help them find their hypertension medications. Giving them, putting a goal around it makes it a little bit more like, okay, I need to teach them these 2 places that they can call if they run out of their blood pressure medicines. Okay, cool. And make sure our client has a way to call them or get a hold of them. Implement teaching plan and strategies. So just some overall things. Teach while you give care. Introduce yourself, why you're here. Get on eye level. Turn the TV off or mute it. Shut the door. Be calm and supportive. Speak the client's language. Printed material is only part of it, right? Making sure that if you don't speak the client's language or the language they prefer or their primary language, they're using the interpreter phone instead of just kind of muddling through it and hoping that they get what they need out of it and call it a day. So making sure that you get the interpreter phone is really a big deal, even if sometimes it might be hard to come across. Let's go the extra mile for our patients, because they really may have a big gap in their health literacy, and we need to make sure that we capture this moment with them and help them to understand what they can do to help themselves and to advocate for themselves. Review teaching approaches. So try different ways of teaching. We're going to talk about some different strategies that you can use, but it's not a one-stop shop, and sometimes it's clients, kind of like when you come in and we're like, how do you learn? You're like, I don't know. I mean, I used to do this. I did this and I was pretty good at it, but now I don't have time for that. So I'm having to switch up my learning strategies, and I don't really know. Patients are the same way. Many of them haven't been to school in years. So when you walk in and you're like, oh, how do you learn best? And they're like, you can just tell me what I need to know. Oh, okay, that might or might not work. So try some different things. Use your tools for instruction. So use whatever equipment the patient's going to use at home. So if your client has a blood sugar machine at home, or they're going to go home on one, have them bring it in beforehand. Why can't they figure out how to work it right there in the hospital with you there to help? Are you going to be an expert on everything? Nope. But they have instruction booklets, and you know more than probably the patient does if it's a new thing. Have them bring in, and you'll see this especially if they're setting them up on like a CPAP machine at home. They'll actually bring the machine to the hospital and they'll put it on there and they'll show them how to use it, and they'll make sure they got a good fit and they're adjusting it right, because they've shown, and studies have shown, if you do that while they're in the hospital and we get all the kinks worked out, they're more likely to use it at home. If you use the dressing supplies in the hospital that they're going to use at home, or at least something that looks the same, the package says the same thing, or it's the same shape, use some of that same materials that they're going to use at home while they're in the hospital. It really helps to decrease some of their anxiety going home, and it helps them understand better. Okay, yeah, that's what that was there. So use those different tools. Here are a bunch of examples of teaching strategy. Right now we're doing lecture. I know, not my favorite either. We could do discussion, whether that's an individual discussion, group discussion, demonstration and return demonstration is wonderful. That's where you show them and then you say, okay, you show me. Show me how to do that now. Now that we've done it and I've kind of shown you, you try it and see how it feels with you doing it. Teach back is wonderful as well, because not everything is psychomotor. Not everything's doing stuff with your hands. Sometimes it's just, do you know what you're supposed to do? Can you do it? So having them teach that back to you. And with teach back, it could be teaching you what you just told them, or it could be, you talked about a certain diet. Okay, show me on that menu what you would pick out that you think might be low in sodium, or show me on the menu what you think might be really high in sodium. Like, can you show me some of those things that we talked about? So having them demonstrate, return demonstrate, or teaching back to you, because remember, 90% of the time, if we teach back or we do it, we're going to remember it. And only 10% of the time, if we hear it or read it, are we going to remember. So keep that in mind when you're talking with your patients. You can do one-on-one instruction. You can use all kinds of audio or video, audio visual aids, videos, printed material. Just make sure that you review it prior to providing education. There are specific program instructions, like for certain things where they have like a little educational series. Simulation, you can do simulation with your clients. Maybe it's them simulating, or kind of goes into the next one, role playing or modeling. How are you going to have this conversation with your healthcare provider? What questions do you have, and are you going to ask the doctor when they come around? Oh, you feel like the doctor is, like, you're bothering them by asking, or you're taking up too much time? Well, pretend like I'm the doctor and you go ahead and ask me. Like, it's okay, let's role play this out. You ask me what you think you want to know, we'll write it down, and then maybe you'll feel more comfortable when the healthcare provider comes around. So you can do that. Computer instruction, there's a lot of that, whether it's distance learning, internet. Kids like technology, right? So there's education, there's ways that we can provide education that are different. It doesn't have to be on a piece of paper. Self-instruction, whether sometimes the best way is to kind of figure it out themselves. So if you can let them try to work with that piece of equipment, maybe that new glucometer that they're going to use at home, see if they can figure out, well, where does the strip go? I don't really know. Let them see if they can figure it out, and then you come in and help and see what y'all come up with together. Gaming is big with kids again. Teach someone teach someone else. So have the client teach their significant other, their spouse, their family member, whoever comes in. Just tell them later on, okay, we were in here earlier and we kind of talked about this. You want to explain to your family member kind of what we talked about, or what we, now make sure first that that's okay, that they're the right person to be in the room for it. But sometimes that really helps you understand what they got and what they didn't get. Tell me or show me what you understand is another way of kind of getting that out of your patient. And involving your clinical resources. There are some wonderful resources at the hospital that have all kinds of wonderful teaching stuff. Our dietitians are great, social workers, our diabetic educator, our skin to wound ostomy nurses. These are experts in their field. And they also usually have other little things, whether they're visual aids or they're great resources, or here's where you go to get this, or, oh, check this out on the internet. This is really great and accurate information about this. They have some great ideas. So you don't have to recreate the wheel and start at scratch. Use what you got first, which is your resources, and then build on that. Last but not least, we need to evaluate. Did our patient understand or not? Have you ever been somewhere and the patient is just like, yeah, and they're smiling and they're shaking their head and you're like, you did not get any of that. Patients are really good at doing that, especially when they're getting ready to be discharged, because they're like, I just want to say yes because I've been here for 2 weeks and I'm ready to go home. So make sure that they really understand. You can evaluate their understanding by observing their performance on something, especially if it's one of those psychomotor skills. Watch them do it. Watch them check their pulse. Are they in the right spot? Are they checking it way up their arm and you know they're probably not feeling it there? Observe them. You can do oral or written questioning. So sometimes there'll be like these little I know people are like, oh, you're giving me a post-test on what I just talked to you about. Sometimes there's some already built up. Just remind them it's not for a grade. It's just for us to know, what do you understand? Where are you there's some gaps so that we can make sure you got everything you need to go before you go home. Sometimes it's just asking them, okay, so we did your dressing change yesterday, and I'm going to do your dressing change again today. What are those signs that you would look for that would be concerning that you have an infection in your wound? Like, what kind of things would you look for? So sometimes it's those oral questions of just asking them and having them retell you. Having them self-report of foods eaten, keeping a food log, picking out stuff off of the menu. Look to see on the evaluation, are we meeting their teaching and learning needs? Are there areas or gaps? If there is any kind of deficit, we need to modify that goal. We need to modify our interventions. We may need to make a referral, include other people on those interventions. We may need to include our diabetic educator or our dietitian to make sure that we have all of those interventions in place that we need to help our clients be successful. So just like when you're doing your clinical decision making and you get down to evaluation, if the goal is not met and there's still some gaps in that knowledge, we need to go up and modify that goal, and we need to change some of the stuff we're doing on our interventions. It may not be that they need to learn something different. It may be that our approach needs to change with it. So there's always some things that that come up as far as evaluation. What if the client is not motivated to learn, or the teaching doesn't result in change? What if they're not ready to learn? So a lot of times tapping into that affective domain is a hard thing to do. I know I need to eat better. I know I need to exercise, but really finding that to be a priority in my life and me to make change off of it because I changed my attitude and my belief about it. That's the hard part, right? So we need to figure out what motivates your client. What motivates you may not motivate your client. Maybe you're motivated by the fact that you're healthy and you're disease-free and you want to, be able to run and play and do. And maybe your client's like, you know what, I'm just working my job. I got a life. I got to pay the bills. I got, money issues. That doesn't motivate me being healthy or running. That sounds like work, right? So figure out what motivates them. If it is money, and you can help them figure out, okay, how are you going to eat healthier and save money? Well, maybe it's not eating out. Maybe it's, okay, well, you can save some money by eating in if you find some healthy ways to make food that, you can eat a couple times, but that's not going to cost as much as eating out. Or maybe it's cutting back on smoking. How much do you spend on a carton of cigarettes? Okay, well, what if you cut back a pack? What if you just cut back a pack a day? That would be this much money a month that you could use towards something else. Do you think that would be reasonable? Or a half a pack, that'd be half of that amount. So seeing if you can find a motivating factor for them. Asking them not why they're not ready for change yet is okay. It's okay to not be ready to change. Many times we hear that clients are non-compliant. Oh, they're just non-compliant. They know what they need to do and they're non-compliant. Well, if you think about all of us, are we really that compliant? Are we really as compliant as we should be? Why are they not compliant? Is it because they don't want to do better? Or is it because they've got so much stuff on their plate right now, they're putting their priorities down low? How can we help them be part of the team to where we can set up some goals to help them say, you know what, I know I need to do better and I want to do better, but I'm so overwhelmed right now, I don't even know how to do better. How can I make this manageable for me? So we really want to get away from the compliance and focus more on how do we help our clients adhere to their healthcare providers' recommendations. Sometimes our clients come in and get a huge diagnosis. I don't want to say that some diagnoses are worse than others, but there are some that require a lot of change. A client that's newly diagnosed with diabetes, a client that's newly diagnosed with heart failure. They require some big changes. Those are just two examples. There's many, many more. You're talking about a change in medications. You're talking about a change in diet. You're talking about a change in exercise. You're talking about a lot of change. And they're people just like us that have just as much time in the day and just as much stuff on their to-do list as we do. So if you try to put yourself in their position and think about, maybe it's not a lack of compliance, maybe it is a lack of, I don't know how I'm going to fit this in my life right now, because right now my life is just really full the way it is. How do we help that person figure out a way to be involved in that care to make meaningful change in their life? Many times people are non-compliant or non-adherent because maybe they're in emotional pain, maybe they're in physical pain, maybe they really appreciate the freedom they have to make those choices, even if they're not healthy lifestyle choices. Maybe they're dealing with so much emotional pain that they're seeking out unhealthy behaviors, and they got to deal with some stuff that's really hard to deal with right now. It's not that we don't need to encourage them to deal with it. We might need to find other means to help them deal with those. Maybe they misunderstood what they need to do completely. Maybe they're scared of change. Maybe they don't have a lot of support to change. Maybe they don't have the financial resources to make those decisions. If the power's cut off, the car don't work, I don't know how I'm going to pay my bills. We can go in there and the healthcare provider can order 5 new medications for them for $500 or $600 a month. But if they've got these financial burdens and we don't try to figure out a way for them to get those meds at a reduced discount free price, they're not going to take them, period. So you can come up with this wonderful plan, but if it's not important to your client and your client can't make it work, they're not going to adhere to it the same way we wouldn't adhere to it. So figure out, if your client is one of those non-compliant people, figure out, well, why aren't they taking their medications? We had a patient the other week that was having a hard time taking his anticoagulant medication. He was back in for a repeat pulmonary embolism. Well, he needed to take his anticoagulant medication. Patient wasn't a great historian to begin with, but come to find out, the patient had a pulmonary embolism, had been on anticoagulation medication, had had a massive bleed to where he passed out. And that was really scary for him, the whole passing out and waking up and bleeding and threw up blood. And that was very traumatic for him. So he didn't go back on his anticoagulant medicine because he was like, well, I don't really want to go through that again. So he had another blood clot. Well, he was non-compliant. He was non-compliant because he saw himself throw up blood and he was kind of scared to go back on it. So figuring out why your patient wasn't. And then when we talked to him about it more, his refrigerator broke. It wasn't the power. It was the plumbing in the house didn't work. He signed out AMA before. Well, he signed out AMA because his sister's car didn't work and his sister didn't have a ride home from work. So he literally just went to go pick her up and came right back to the ER. So is he really non-compliant, or is he not making great health decisions because we haven't helped him with resources? So we need to, instead of labeling people, we just need to help them. Does that make sense? All right, I'm gonna get off the soapbox, sorry. Steps for documentation. So last step is we need to make sure we document that patient education. It may be absolutely wonderful, but if you don't document it, it's just like anything else. You can't really prove that you did it. So I'm gonna go ahead and pop these up here and let's talk through them. So document readiness to learn. Maybe it's your client was pain-free or your client's pain level was at a 2. Maybe it was that your client was asking a question that shows their readiness to learn. Document if you provided education on the disease state or the illness or the condition that was being addressed. List specific education topics. Did you teach them how to check their heart rate? Did you teach them when to hold their blood pressure medication based off of heart rate or blood pressure? Did you teach them what class of blood pressure medicine it was, or some of those side effects? The level of the patient family understanding of the material. Did the patient state it? Did the patient teach it back to you? Did the patient demonstrate that they checked their pulse and they were within 5 beats of you or 2 beats of what you got? Documentation of goals. is part of your nursing documentation. There's a place in most electronic health record systems where you have to set goals. Any comments or follow-up that's needed, maybe the client did okay with this, but they still had questions about that. And then the initials of the provider or whomever did the education, whether that was the healthcare provider you saw provide education, you can put that Dr. So-and-so was in the client's room and provided some education on blah, blah, blah. Maybe that's you documenting that you did that education. Nurses are legally responsible for documenting their teaching, not just what you taught, but how you evaluated your teaching and if learning occurred. So it's not enough just to spit it out there and say, good luck, peace out, wish you well. But we actually want to make sure, like, hey, did you get that? I want to make sure you understand that. I'm sorry to keep bringing this back up, but have you figured out, do we have it set to where you're going to be able to take care of yourself at home? How are you going to do this? How are you going to do that? It's okay to ask those questions to your clients. It's helping them think through stuff that you know they're going to have to deal with at home, but they haven't thought about that yet. So effective teaching. You can teach, but you not necessarily are effective. And I understand that. There are times when I feel less than effective as well. But we want to teach every time we enter a room. We want to make sure that we're hitting them at the right time. So is our timing right? Are we doing the right content? Do we have the right goal? Are we in the right context of when we should be teaching? Are we using the right method? Effective communication techniques. First and foremost, clients can kind of tell when you're not sincere. You're just coming in, doing your job, checking the box. So be sincere. Be honest and genuine and respectful for your clients. There are all things that we could improve upon. Maybe you're timid about teaching your client about exercising because you don't exercise. Maybe you're timid about teaching your client about weight reduction and you're overweight. It's okay. It's okay to say, you know, this is something that I struggle with too. It's something that I need to do better on. Here's some things that I've tried that, you know, have worked for me. Here's some things, what's some ideas that maybe you think you could do to incorporate in there? We're not perfect. They don't expect perfection, but they do expect honesty and you to be real with them. Stick to the basics. Keep it simple. Ask them if they have questions and be willing to take the time to answer their questions or to find out the answers to their questions. Be a cheerleader for your patient. Like I said, we all got places and things that we could do better on. So believe that your person can do this and wants to make a change. Keep it clear and concise. Try to listen to them without interruptions. Sometimes that's hard, especially if you have a talker, but let them get out what they need to and say, okay, let's focus down right now on this part right here and see if this really helps you with your understanding. I hope that helps a little bit. I would like for you the next time you're in clinical, which I realize that's going to be a couple weeks out for you. But the next time you're at clinical, I want you to do some purposeful patient teaching, whether that's going in the room with med and men, whether that's teaching them about signs and symptoms of infection post-op, whether it's teaching them about how to use their incentive spirometer. I want you to really be purposeful in your thought process of when you're teaching, what you're teaching, how you're teaching it, and how you're evaluating that teaching. Thank you so much. Like with anything, if you have questions or concerns, please feel free to email me. See you soon.